go. Ready? Okay. Good evening. My name is Renee Eckler. I'm a student at Aspen University, and I'm doing a presentation for Community Health Nursing 2. I did a community assessment earlier in July on the town of Springfield, Vermont. A community, as defined by the Merriam-Webster Dictionary, is a group of people living in the same city, town, or neighborhood. Some communities are located in more urban areas, such as big cities. However, Springfield is located in a very rural environment in the Green Mountain state of Vermont. Springfield is a small town located on the eastern part of the Green Mountain state and is situated along the Connecticut River. While Springfield's picturesque mountains and beautiful dairy farms lure tourists and leaf peepers, the actual town of Springfield is anything but idyllic. The statistics show the population is approximately 4,000, with actually 10,000 if you include the surrounding smaller communities of Springfield. It's 95% white. 94% have a high school education, but only 14% have a degree, have a college degree. So what I chose after doing my community assessment and doing my windshield surveys, going through the town and seeing that many of the buildings have empty storefronts, a lot of young people loitering around the downtown, not having jobs, a lot of old mill buildings that are closed up with broken windows, empty parking lots that are overgrown with weeds, and the actual buildings being with climbing ivy all over them. And finding out that 25% of the population of Springfield actually lives below the federal poverty level, I chose to do the social determinants of health for my community project. As I looked through the Healthy People 2020 objectives, the social determinants of health is the one that stuck with me the most, because it seemed that many of the people in Springfield are faced with many obstacles and challenges to getting health care and oral health care for prevention and treatment. In addition, I'm an emergency room nurse at the local hospital, and I was astounded when I started 3 years ago about the number of people that come to the emergency room for dental care. Over 120 patients come to our emergency room every year for care that could be treated by a dentist as an outpatient. However, some of these people, their conditions get so advanced that they end up with abscesses and infections, and they require IV antibiotics. And prevention would be far cheaper than having to treat these people for infections and then subsequent treatment by a dentist or an orthodontist. So that being said, I'm going to show you some of the things that I chose to do for my community event. When I chose the social determinants of health, I had to first figure out what the determinants of health were. Some of the social determinants of health are: number one, education. As I said previously, Springfield, Vermont has only 14% of the people that live in Springfield have a college degree, but 94% do have a high school education. Social and community support systems. So many people in Springfield live at or below the poverty line, and many of their support systems are lacking or live in the same types of conditions that they do for the people in the community. The neighborhoods and physical environments. Many of the apartments that I saw towards the center of town were old, run-down, multi-complex apartment buildings that are, as my neighbor said, Paul Ferguson had said in my Module 7 assignment, were run by slumlords. A lot of the apartments around the center of Springfield are subsidized housing, and you'll see a lot of people from the lower socioeconomic spectrum living in those places. Financial stability, or should I say financial instability, is what affects many of the people in Springfield, Vermont. Lack of job opportunities, inadequate transportation or unreliable transportation, and geographic isolation often contribute to financial instability. in access to health care, or should I say in access to health care. There are a limited number of primary care providers in this small community. In addition, 2 of our pediatricians left in the past year, and right now we only have 2 to care for the entire community of pediatric patients. We also have only a certain number of primary care providers that are taking new patients. Some of our primary care providers that they're hiring on now are nurse practitioners and physicians and assistants. Fortunately, research shows that people fare just as well with these mid-level practitioners. However, gaining access to dental care is another obstacle in and of itself. Again, there are a limited number of providers, but also if a patient doesn't have insurance or the provider doesn't accept Medicaid, then that presents a whole other obstacle to gaining access to preventative health care. The Healthy People 2020 campaign identified social determinants of health as essential for the promotion of equitable health care across the socioeconomic spectrum. It bothered me deeply to realize that a quarter of the population of the town that I live in don't have access to adequate health care or oral health care. And that these are the people that we often see coming to the emergency room for treatments that could have been taken care of as an outpatient with a preventative dentistry. As I said previously, in Springfield, Vermont, more than 25% of the populations face a number of social determinants of health, including poverty, inadequate transportation, and geographic isolation, inadequate or insufficient community resources, inability to access healthcare providers, lack of healthcare coverage, lack of healthcare literacy, and unstable housing. All of these things can create a constellation of problems, leading people to have poor oral health and poor health overall. Other statistical facts that I presented on my board here about Springfield, Vermont, states that while 25% of the people in Springfield are affected by poverty and live below the national poverty level, 44% of the children in Springfield have dental caries that could, or some other form of preventable oral condition. 67% of adults in Springfield have one or more issues with their oral health. And the causes for these are numerous, many of which I just mentioned. Other problems, such as lack of providers, lack of access to fluoridated water, and lack of preventive care can all lead to oral health problems and conditions that could be treatable and prevented. I chose to do an oral health promotion campaign with 2 small community events, one of them situated in the cafeteria at Springfield Hospital. The bonus of choosing Springfield Hospital is that I was an employee and the space was free. The cafeteria also provided an opportunity to see a lot of foot traffic. There's usually over 100 people during lunchtime that come through the cafeteria. I was able to set up a display. This is the display in the main dining area. And also the benefits for me of doing this community health event in the cafeteria was that I was able to speak with many of my coworkers. While I didn't actually get to speak to much of my intended target audience, the coworkers that I was able to speak to, one of them was the medical director of the emergency room, the nurse manager of the emergency room, the nurse manager of the med-surg unit, and the nurse manager of the oncology and birthing center. I was able to engage in conversations, and these are the types of people that could help promote change within the community. They could help make contact with the state and other healthcare providers to see what changes could be made to help alleviate some of the obstacles residents in our community face in obtaining preventative oral health care. One of the goals that I chose while doing this event was to improve the public's perception of the importance of oral health. And the second was to emphasize the need to prioritize oral health diseases alongside other serious conditions. Many times, oral health is set aside as secondary, when in fact, it should be equally as important as other parts of our body. Some of the things that I had on display were very simple things that can help with preventative care. Toothpaste, Colgate and Crest, and I am not being brand loyal, that's why I bought both. Dental floss and a toothbrush. Some of the other things that I was able to discuss with the people that went through the cafeteria during the peak lunch hours were how dental care can affect your health. Dental care can cause conditions like endocarditis, sepsis, osteomyelitis of the jaw, brain abscesses, pulmonary problems and conditions that could be prevented, and even preterm labor. So poor oral health can cause a number of problems that could be prevented through preventative dentistry and proper oral health care. I also showed a most unpleasant picture of what poor oral health can look like if it's advanced. Some of the things that we can prevent with preventative dentistry are plaque and tartar and periodontal disease and gingivitis. Some of the other things that I had on my display were the basic concepts of maintaining good oral health. Some statistical facts, such as 1 in 4 adults in this country with non-group coverage went without needed dental care because they could not afford the cost of the care themselves. This usually includes the working poor who do not have access to care. And unfortunately, many private practitioners do not accept Medicaid if the person is on state insurance. There's also had a display about why we need our teeth and healthy teeth. We need our teeth to speak clearly. Try to say teeth without touching your teeth with your tongue. We need our teeth to help grind our food into small particles that are easier to digest. We need our teeth to break food down so we can swallow easier. And we need our teeth to be healthy so we can have nice smiles. And healthy teeth often equals a healthy body. I also had a list of dental do's and don'ts and a list of dental clinics in the area that do accept Medicaid for payment. The second presentation that I did was at Susie's Little Peanuts Preschool in Springfield, Vermont. It's where my daughters go, and I'm familiar with the teachers and many of the students. The children at Susie's Little Peanuts engaged in an art project designed to promote good oral health. Because everybody deserves access to preventative oral health, and everyone deserves a healthy smile. And this is the little thing that we did at Susie's Little Peanuts. And as Cervantes said, Miguel Cervantes said, every tooth in a man's head is more valuable than a smile. I know I kind of bumbled a little.